Depending upon examinal space and individual preferences, there are multiple ways to position a patient for shoulder examination. Patient seated on a revolving stool provides an easy access to all parts of shoulder for sonographic examination. The anatomical structures which can be examined with the ultrasound include biceps tendon, subscapularis tendon, supraspinatus tendon, and subacromial subdeltoid bursa, coracohumeral, coracoacromial, and transverse humeral ligaments, AC joint, infraspinatus tendon, teres minor, glenohumeral joint, glenoid labrum, and spinoglenoid notch from posterior view, and also a suprascapular notch for evaluation of suprascapular nerve and artery. Skeletal landmarks are important for proper sonographic examination of musculoskeletal system. Easily identifiable skeletal landmarks on anterior shoulder examination include clavicle, acromion, coracoid process, greater tuberosity, lesser tuberosity, and the intertubercular groove between the tuberosities. Longer the biceps and subscapularis tendon are routinely examined while performing sonographic examination on the anterior shoulder. The long head of the biceps takes origin from the supraglenoid tubercle within the joint capsule and is enclosed in the synovial sheath, which is a prolongation of the synovial lining of the glenohumeral joint, and it passes over the head of the humerus through the intertubercular groove where it is retained by the transverse humeral ligament. The subscapularis is a multi-pennate muscle arising from the subscapular fossa. The fibers converge to form a tendon which crosses over the anterior aspect of the shoulder joint and attaches to the lesser tuberosity of the humerus. The tendon is separated from the neck of the scapula by a large subscapular bursa which communicates with the shoulder joint. These are some of the important ligaments which should be examined while performing a sonographic examination of the anterior shoulder. The coracoacromial ligament is a strong triangular band between the coracoid process and the acromion. The coracohumeral ligament is attached to the dorsolateral base of the coracoid process, and it extends as two bands, one to the greater tuberosity and the other to the lesser tuberosity, and it also blends with the joint capsule. The rotator cuff interval is reinforced by the coracohumeral ligament. The transverse humeral ligament passes between greater and lesser tuberosities. It acts as a retinaculum for the tendon of the long head of biceps. On the posterior aspect of the shoulder, the palpable bony landmarks are spine of scapula medially and the acromion laterally. The head of humerus is palpable below the acromion. The shoulder joint is a synovial joint between the glenoid cavity of scapula and the humeral head. The glenoid cavity is deepened by a rim of fibrocartilage, the glenoid labrum. The joint capsule is attached to the scapula just outside the glenoid labrum. It is attached to the humerus close to the margins of the humeral head, except inferiorly, where it is attached to the shaft of the humerus about 2 to 3 centimeters below the edge of the articular cartilage. Let's look at suprascapular nerve and vessels. The superior transverse scapular ligament converts the suprascapular notch into a foramen. The suprascapular nerve passes through the foramen and the suprascapular vessels cross over the ligament. The inferior transverse-scapular ligament or the spinoglenoid ligament stretches from the lateral border of the spine of scapula to the glenoid margin. It forms an arc over the suprascapular nerve and vessels as they enter the infraspinous fossa. Let's look at the rotator cuff muscles attached to the dorsal surface of scapula. The dorsal surface of scapula is divided into a supraspinous fossa and an infraspinous fossa by a shelf-like spine of scapula. The supraspinatus muscle takes origin from supraspinous fossa, passes laterally under the acromion and deltoid muscle and is attached to the upper part of the greater tuberosity of humerus. It is separated from the deltoid muscle by a subacromial subdeltoid bursa. The infraspinatus muscle takes origin from the infraspinous fossa, passes laterally across the posterior aspect of the shoulder and is attached to the middle of the greater tuberosity of humerus. The teres minimus muscle takes origin from a narrow strip on the posterior surface of scapula and close to the lateral border. It passes laterally and is attached to the lower part of the greater tuberosity of humerus. The subacromial subdeltoid bursa covers the entire shoulder under the deltoid muscle. It is separated from glenohumeral joint by the rotator cuff muscles and tendons. The normal bursa appears as a thin hypoechoic line between the two layers of hyperechoic peribursal fat.